Hi, and welcome to Smith Spinal Care Center. I'm Blaine. I'm an on-air personality with 96.5 The Bull in Macon, but I'm also a patient of Dr. Smith's. I came in because I was diagnosed with scoliosis when I was younger, and I've always had back pain, so I decided to try chiropractic, and I'm really glad I did, and I would like to introduce you to Dr. J.C. Smith himself.
Hello, Blaine.
Hi. Tell us a little bit about how you got into chiropractic care.
Well, when I was playing football at the University of California at Berkeley, I got hit by a 230-pound defensive end who drove me into the ground. When I came to 20 minutes later with a slight concussion, I couldn't move my arm and neck. And that's what drove me first to pain pills and muscle relaxers that the team doctor gave me. They didn't work. They got me high and constipated. So my roommate, who was an Olympic long jumper, said, why don't you go see my chiropractor in Oakland, who was taking care of the Oakland Raiders? And so I did, and they carried me in. And with one adjustment, I was still sore, but I was able to walk out. And then that was my renaissance about spinal care, because I went back to the team doctor, and he was so happy to see me back at practice. And he said, well, I guess those drugs worked. And I said, no, they didn't. I said, I went to a chiropractor instead. Oh, wow. He was upset. He says, well, you shouldn't go there. Chiropractic doesn't work. I said, how can you say that? Aren't I proof that it does? Well, that was my introduction to the medical war against chiropractors. And now, 35 years later, I've come to a few conclusions. First of all, is the medical approach to back injuries, pain pills, muscle relaxers, epidural steroid injections, and back surgeries, is a bust. Actually, spinal researchers now are in total agreement to the point that a spine newsletter editor actually wrote that medical spine care is the poster child of inefficient care. To this day, more and more people are beginning to realize that drug shots and surgeries for back pain doesn't work for the majority. There's always a 10% that have cancers, fractures, infections, and serious odd issues. But for 90% of Americans, their back pain is due to what's called joint complex dysfunction. Most people don't realize it because they think a back problem is generally what? A pulled muscle, slip disc.
Oh yeah, you hear that all the time.
If I were to send those in to the insurance companies, they would deny it as a wrong diagnosis. Neither of them happened, and it certainly isn't the cause. And next, we're actually in 1990, most of this renaissance in spine care started right up here at Emory University. Dr. Scott Bowden, a renowned orthopedist researcher, he runs their spine center. He did MRI studies on people with and without back pain, and in both cases, he found bad discs, again, in people with no pain. And he was the first one who brought that to attention. Well, we chiropractors have been saying that forever, that back pain is generally some problems with your spinal joints. But since most people don't know you have spinal joints, that's not part of their concept. But actually, there's over 361 joints in the human spinal column. And that's what we adjust, and that's what goes pop when people are adjusted. And that's what happens. They get locked together, twisted, or torqued. It's compressed from prolonged sitting, and then you start having the reflex spasms and pain. So with that in mind, you go to the MD, and he's going to throw drugs at you. When that doesn't work, then he wants to do shots, and then they say, oh, you have an old disc in there. But like I say, they're finding bad discs in pain-free people. And then they have back surgeries. And do you know anybody who's ever had successful back surgery?
Not successful, no. I mean, they're still in pain or, just kind of stiff and uncomfortable all the time.
There was a study recently. There was 993 workman's comp patients who had low back problems, and they had surgery, and they gave them 2 years to recover. It's a long time, isn't it?
A very long time to recover.
And of that, only 24% were able to get back to work. And they were still taking opiate painkillers, which doesn't sound very successful to me if you're still on pain pills after the surgery. But also, 76% didn't go back to work. And these are the people who become addicted to those pain pills.
And that's a very, very common occurrence.
It's epidemic. People don't realize the mismanagement of spine care has now caused back pain to be the number one disabling condition in the nation, the military, the workplace, and in the world. 33% of Americans every day complain of back pain. 66% in a year will have back pain, and 90% of their lifetime will have a back attack. And again, you ask, why? Are we just more susceptible? Well, that may be, but also it's the fact that no one's teaching Americans how to take care of their backs. For example, the dentist and toothpaste commercials have taught you how to take care of your teeth, and there's more information about how to take care of your heart so you don't have a heart attack and clogged arteries, and sugar control for diabetes and weight loss. But no one has really taught you how to take care of your spine. Have you ever had any anyone teach you?
Not until I started chiropractic care.
That's actually a bit too late. Many of my patients, as they found, most adult back problems begin in youth. 3 out of 5 adult problems begin in childhood when kids fall off bicycles and roller skates. Cheerleading is the number 2 cause of back injuries among teenagers. Of course, football is number 1. And then you compound that with car accidents and other sports injuries as adults. And then prolonged sitting is probably just as bad because it compresses all these previous misalignments. Then they finally come to see me when they're 40 years old. And I tease them. I said, that's like, waiting till you're 40 before you see your first dentist and learning how to take care of your teeth. But that's the situation we find. And again, for those people who went the medical route, drug shots and surgeries, they're still clueless. And that's why it's a number 1 disabling condition. It's so sad because this is all preventable if people were to learn from the get-go. That's why I'm real big on bringing kids in to teach them. So in my office, what I like to teach patients is not just what we do, the logic behind our treatments, but also teach them the principles of spinal rehab. Do you remember?
Oh, the 3 principles.
I'm putting you on the spot, aren't I?
You are. One of them is flexibility.
Right.
Compression.
That's 1.
I can't remember these.
Alignment, strength, flexibility, and compression. In other words, the spine should be straight, right? That's what we do. Adjust the spine, hopefully to help restore the normal alignment. Joints should be flexible. It's when they get stuck, locked up, or as they say down south, all stove up. Have you heard that expression?
Yes.
Well, that's what they're pertaining to. I'm stiff and sore. And of course, strength. You have to have core strength. And this is a big problem as adults is they lose their core strength. That's why sitting is so bad and compresses you and you lose your muscle tone. And then, of course, like I say, compression is the big thing now because sitting all day, actually you put 5 times more compression in your spine than standing. Isn't that odd? You'd think it would be the other way around, right?
Yeah, you wouldn't think you would put that much.
Sitting just compresses. That's why you have to have the proper chairs and such to alignment, strength, flexibility, and then compression. That's how we approach spinal problems. We just don't throw drugs and shots at you. Those epidural shots have never been approved by the FDA for back pain.
That's scary.
But that's what they do. For $900 a shot, I'd shoot you too. But they don't work. And they also can lead to serious things like heart failure, blindness, strokes, paralysis. That's something they often don't tell you. And then when that doesn't work, they send you in for the back surgeons. And as I said, the disc theory is dead. In other words, surgery doesn't realign you. That's what people think that, say you have a broken arm. Oh, they go in there and they straighten it. They cast it straight and it heals straight. Unless it gets infected, it's okay. But back surgery don't straighten you out. They just fuse you in a misaligned position. So all that mechanical problem moves to the next vertebra disc level and it starts over and they say, oh, we got to do another and another. I mean, I've had patients in my office who've had as many as 5 back surgeries. It doesn't work, and that's what the research is saying now, but that's what they do around here. That's why you can avoid all that. Even if you've had back surgery, they can still be helped because they're still misaligned, they're still compressed, and they've lost their core strength, and they're still inflexible. I have hundreds of patients with failed back surgery. Now, they are a more difficult case, but nonetheless, even after we do our treatments, patients have to realize is that you've got to strengthen your spine, just like a football player who twists his knee. It's one thing to do the rehabbing of the, realigning the knee joint and tacking up the ligaments that have been destroyed, but if you don't strengthen it, as you gracefully age and muscles get weaker, like Bob Hope once said, you're getting old when your back goes out more often than you do. and that's true, and it's because as you age, you do lose muscle strength and you do more sitting, and so you're bound to have more relapses. And I have, a lot of my patients, I give them self-care advice, proper sitting, lifting, bending, and also home exercises. And I do these myself. And as I say, I hurt my back years ago, and I know what it's like to live with a bad back and have relapse. So finally, I started taking my own advice, and since then, I've been doing self-care home exercises every morning. And on the other hand, most patients don't. So when they come back with a total relapse, I tease them. I said, you're my prodigal patient. It's like a dental patient going from toothache to toothache with no toothpaste in between. And they laugh at that because people know you've got to do preventive care for your teeth because nobody likes getting the dentist drill, right? Unfortunately, that's a hard lesson for people to learn about the spine care because, again, no one's teaching them that. If you don't do spinal exercises, I can guarantee you will have a relapse. It may take longer or shorter. It depends on your lifestyle and how strong you are, but it will happen. We give patients exercises as well as recommendations for particular types of tables that they can buy and such. So there's a lot to learn about spinal care, and it does take a lot of self-responsibility. Otherwise, if you don't, you're going to be part of that statistics where it's the number 1 disabling condition in the country, especially in the military, workplace, workman's comp injuries, as well as worldwide now. And again, it has to do with the fact that patients are just not learning from childhood how to take care of themselves.
Yeah, and a lot of people, though, they're scared of chiropractic. Why do you think that is? I mean, to me, chiropractic seems like a better alternative than going under the knife for surgery. But why do you think people are afraid of it?
Well, first of all, did the spinal adjustments bother you?
No.
Yeah, they feel good, don't they?
Yeah, they feel very good.
It's like popping your knuckles. You get a sense of relief. Your question's very good. And a book I've written called The Medical Organs Chiropractors details the whole propaganda campaign that the medical profession did against chiropractors. It began in 1930. This is not a new phenomenon. Their executive director of the American Medical Association put out, he was a prolific writer, spokesman, Capitol Hill lobbyist, and he put out a lot of the original misinformation. Then that continued after he left in the 1960s. The AMA had a committee on quackery whose goal was to contain and eliminate the chiropractic profession. And again, they had no proof of any of their claims. It was just bold-faced lies. So our profession took him to trial in an antitrust trial in 1987. It lasted 15 years. It was the biggest antitrust trial ever. And all kinds of interesting research came out. Workman's comp studies show that we were getting people better in half the time back to work. Doctors who worked in hospitals that used chiropractic claimed that they got people out in half the time compared to hospitals that didn't. And since then, a lot of research has come down. So all of that is basically disproven, and the judge, she found in our favor, but by then the damage was done. You may remember Ann Landers, the syndicated columnist during that period. She was on their payroll. They had many people who were putting out misinformation, but people didn't know that she was on their payroll. And even to this day, there's nationally known broadcasters at CNN in particular who are putting out misinformation. That's one reason I wrote my book. And again, even though we won that trial, and where do you go to get your reputation back? Plus, another point is that, have you ever seen in the media an in-depth, fair and balanced article about the benefits chiropractic brings in ailing world suffering with back pain? Never.
No.
And we're the third largest health profession in the world amidst a back pain epidemic. And so you wonder, why is that? I mean, this is huge, right? Well, again, in my book, I point out that, first of all, most health reporters are MDs, like Sanjay Gupta, who's a neurosurgeon. And there's no way an MD will ever talk favorably about a chiropractor. That's like getting a Republican to talk favorably about a Democrat, or vice versa. And second of all, who sponsors these shows? The drug companies.
Oh, yeah.
You know that the medications sold for back pain alone last year was $17 billion. Oxycontin alone earned $3 billion.
That means there's a lot of high people out there.
Yes, and they're driving cars. They're finding this is a big problem because they are inebriated. It might not be alcohol, but it's pain pills. There also is facts showing that the drug companies pay television $4.5 billion to get their word across. So obviously, with the lack of information in the media about chiropractic care, because the medical profession and drug companies control it, people just don't know about the benefits we bring. That's why most of chiropractic clinics, they grow through word of mouth, just like with you. But I dare say that with the number of back pain cases, chiropractors should be the busiest offices in town. And another point that people haven't learned is that, the original chiropractor wasn't looking for the cure to back pain. That was not at all his intent, although our methods have proven best for that. He was trying to figure out, why do people have premature organic failure, like heart attacks and such. And he was what we might call, by today's standard, a neurophysiologist, because underneath the spinal column is the spinal cord and all those nerves that control muscle and organ function. So when you have misalignments in the spine, it causes, classically they call it pinched nerves, but it isn't. It's nerve inflammation, nerve interference. And it's like shorting out a wire in your car. It causes malfunctioning, right? Mm-hmm. And so a lot of patients who come to chiropractors with their back aches and neck aches, we adjust them and other things start improving. And research is showing this now. Blood pressure can normalize, digestion improves, people sleep better. I mean, you never know where those nerves are going that will improve function. And that's real high tech. That goes over most people's heads when you start talking neurophysiology. They don't even know what that word means, right?
Right.
But that's kind of the next realm of chiropractic care that is the public has yet to learn. But they usually learn it when they come into the offices and they start saying, why are my allergies better? Why am I breathing better? In fact, why are my organs working better? There was research in New Zealand on this, and they found that was the case, that people were getting better. They didn't know why, and that's what has led to this neurophysiology interest in our profession now.
Well, and like you said, I did learn about chiropractic care through word of mouth because, like I said earlier, I have scoliosis, and I was diagnosed when I was about 12, and I was put into a back brace for a few years, and then finally I had quote unquote stopped growing, and therefore there was nothing else they could do for me, but I was borderline surgery. And I was a dancer. I was in ballet, tap, and jazz, and the thought of having to stop all of that to go have back surgery was very, very scary. And so I was like, well, since I'm just borderline, maybe I can, manage. I was really excited when I found chiropractic care that would help with the pain, and I didn't have to go through the back surgery, which may or may not have made it better.
Well, like I say, there's a 24% chance you'd still be also living on opiates. I have a lot of patients who come to me after the surgeries, and my heart goes out for them, because what do you say to someone who's had a major surgery they never needed? I mean, honestly, all the guidelines now say do conservative care first, chiropractic adjustments, therapeutic massage, self-care exercises, even acupuncture and things like that, non-drug, non-surgical things, all should be tried before drug shots and surgeries. Unfortunately, the medical world, because they have that bias against chiropractors, and they don't really know the guidelines. This came out at trial also, is that most MDs are not even trained in musculoskeletal problems. They're interested in organs and such, right? And what they know about back pain is really antiquated. Everything's a slip disc, which has been disproven. Nonetheless, they're misleading people, and that's why a lot of patients, when they come to see me and get better, then they get mad. Why didn't tell me to go to chiropractor first? I said, that's a good question. The next time you see your MD, you should ask him or her and see what they say. And if they come across with some bias mumbo jumbo, which most do, then you really can't trust them. And if you can't trust them about back problems, can you really trust them about heart problems? For example, those statin drugs they hand out, Lipitor, those have been totally disproven. They actually cause heart problems and lead to Alzheimer's because it breaks down cholesterol, which your brain needs, right? Cholesterol, healthy cholesterol. They've misled the public on so many issues, and like the overuse of antibiotics have created superbugs nowadays, MRSA. Most people don't realize that back in the 1930s when they started that campaign against chiropractic, it was financed by money the AMA got from the tobacco industry. You're way too young to remember this way. But in early television and even in radio and magazines and newspapers, there are pictures of doctors smoking cigarettes, endorsing, cigarettes. You can Google this. And that was in exchange for millions of dollars. They made a deal that they could use their images in advertising. They had booths at the medical conventions handing out tobacco products. They were able to advertise in medical journals, and that lasted from 1930 to 1986. So for 56 years, the AMA, the so-called guardians of your health, said nothing about the danger of tobacco, which now kills 500,000 people a year die still from tobacco. And you wonder, well, where were they? Why? They knew this. The research was there. They just weren't telling anybody. And it's the same kind of secrecy about chiropractic care. They know the research. They know the guidelines that say go to chiropractors first. But why aren't they telling anybody? Because there's more money in drug shots and surgeries. That's why. It's so sad, but back surgeries themselves is over $100 billion a year industry. And honestly, their own experts say 90% of them are unnecessary. 90%, not 1 or 2, but 90%. And again, they're leaving a wake of disability behind. You don't recover from an unnecessary back surgery. You might get over an unnecessary tonsillectomy or appendectomy or minor surgery, but you don't get over a back surgery that's failed. And that's when people turn to the opiate painkillers, Oxycontin type things, and then their life is just a mess. And that's why I encourage those people. If you know people like that, tell them to come see me. They can be helped, but nonetheless, they usually have to find it out the hard way on their own, or like you did, through word of mouth. So it's a real problem. You can see why back pain is the number one disabling condition in the nation, in the world now, because it's so mismanaged. There's so much misinformation. It's so sad.
Yeah, and I make sure I tell everybody, that I go to a chiropractor for my back pain, because I know a lot of people that suffer from issues, and I'm like, have you tried chiropractic care? Because like you said earlier, it improves sleep. I've had improvement with my headaches. It's not just my back, it's a lot of other things too. And
that's the quality of life.
Exactly. It's totally worth it. And the thought of spending a ton of money on a back surgery that is going to just leave me broke, for one, and then on top of that, still in pain.
It's so sad. Like I say, there's a time for that if you have cancer, fractures, infections of the spine, but for mechanical back problems, no, it doesn't work. And unfortunately, Macon is the back surgery capital of the state of Georgia, and it's fourth on the list nationally. And all these pain clinics are making a ton of money doing the shots and handing out opiates like Halloween candy. So it's a real problem. And then, like I say, patients have been soiled by the medical prejudice. That's what I call chirophobia, so that many people don't know where to go, just like your friends. If you said, Jess, go to a chiropractor, they kind of draw this blank, like, but I thought chiropractors were quacks.
Yeah.
It's medical prejudice. It's just ingrained. I remember Stephen Colbert in one of his shows, he called it an acceptable prejudice. It's no longer PC to be racist or sexist or homophobic or anything like that, but it's still okay to be a medical bigot, where it's okay to bash the chiropractors. That's why I wrote my book, trying to say, look, there's a history to this. If you knew the history, you wouldn't be inclined to have that attitude, especially if you're a victim of that. That's what's the problem. People go in there thinking, oh, I'm going to be well with this quick fix surgery, and then they realize they're not well. And then they come, hopefully they come into a chiropractic office, but most don't. They go back for another surgery, or then they end up living on Oxycontin the rest of their life. And again, that's, like I say, that's no way to live.
Well, and even if you don't have back pain, chiropractic can still be beneficial. So, I would recommend it for even kids. You can adjust children as well as adults.
That's right. That's the best time to start, is when they're young, and introduce them. And like I say, not all my patients are in pain. And those who only come when they're in pain, I tease them. I said, well, do you wait till you have a toothache before you see your dentist?
Right.
And they laugh. I said, well, it's the same thing. You don't have to wait you're in pain before you come see me, because, again, a lot of these back problems from sitting are incremental. The joints start to creep, and then they buckle. And that's when people say, but all I did was sneeze and my back went out. Well, it's because it's been going on. It's just finally came to a head. It's literally the straw that broke the camel's back. I know there's a lot to learn. That's why I say, and we can't hope to teach them in this one fell swoop here. So that's why when they come to my office, I teach as I treat. I hand out educational brochures, and I give a lot of information on just how to be well, how to prevent a back attack, heart attack, fat attack. But of course, it begins with having a healthy spine. So to remind you, the principles of spinal rehabilitation are alignment, strength, flexibility, and compression. And again, there's 137 major joints in the spine, although there's 361 altogether. So when people start understanding these principles, then what we do makes better sense.
And that's what I like, is that you guys do give education along with the treatment. A lot of doctors will prescribe something and not really explain to you anything about it. And so I like being educated on how to take care of myself.
Yes, I find that when patients come to see me or on Oxycontin, I said, did anybody tell you what the active ingredient in that is? And 9 out of 10 are not told that it's medicinal heroin. That's why it's so addictive. I said, your doctor never told you? Did the pharmacist ever tell you? No. And so, isn't that odd? They're handing out medicinal heroin like Halloween candy, and no one's telling you, by the way. And when I tell people that, their mouths drop open, their eyes get wide, and I find that so odd. I think there's someone should step up and say there's some ethics involved here. You need to tell people what you're doing to them, but don't get me started.
Well, I definitely recommend chiropractic care for the entire family. It's definitely helped me with my scoliosis, with the back pain that comes from that, and with the headaches. So I definitely recommend Smith Spinal Care Center in Warner Robins, and I hope you have enjoyed this and learned something from it.
Thank you, Blaine.
Thank you.